can't let themselves in or out of bed. And that's where my analogy about itching the face kind of falls apart, because these guys can do whatever they want to, but they just have to do it in the bed. These are considered restraint and do require physician orders. We also have posy vests. So posy vests go on front to back. They zip up in the back. Realize they do come in different sizes. Don't put your little 45-kilo Nana in a triple XL, because she's going to like strangle herself, right? And what you want to do is make sure that you have these two straps tied to, and in your ULearn module, it's going to say movable bed frame, not the side rails. Okay, which to me took me a minute to wrap around, because I don't want a movable part on the bed. But it's basically like, if the patient's laying in the bed, you don't want to tie it to the part of the bed that doesn't move, because if you're adjusting the patient up and down, you know, the head of the bed up and down, you want the restraint to come with the patient. But just know it's not the side rails, okay? And then in a single release knot. None of the units stock posy vests, because we really try to avoid using them as much as possible. For some folks, it makes them even more confused and aggressive, and so we'll actually use sitters rather than posies at times, depending on what our staffing availability is and what we think is best for the patient. This does require a physician order. It is a restraint. What else? Talked about that. Body holder and safety belt. So there are things that come on our cardiac chairs or Cadillac chairs, depending on what part of the country you're from. That's a seat belt. That's to keep the patient on it's part of the chair. That's not a restraint. Okay? But this, what's this? Gait belt. If you tie your patient to the chair with a gait belt, that's a restraint. Please don't do it. You know, we worked really hard to get gait belts for all of our patients, and we would like to keep it that way. So just don't use sheets to tie your patient to the chair. I've seen it all, trust me. But the one that you'll see the most often will be the simple wrist restraints. And what I do need to see everybody do is to apply it to their friend or themselves if they're handy like that. And then when you tie it to the chair, I just need to see a single release knot. Or for those of you who are sailors or farmers, a half hitch. I'll just give you this. I'm going to give you guys what you want, and then if you can just clean off of them too. Yeah. I'll put one that was here.
She was just here.
She'll be back.
Yeah, do you need her?
She'll be back.
Okay.
Yeah.
So these have a buckle and Velcro closure. They don't have clips per se. I'm gonna have to borrow some. Sorry guys. Just pass those back actually. I'm not sure you guys have been told this, but you're a very large group. I'm sure you've heard this more than once. What's that? So what you'll do is to apply it. I'm gonna borrow your To apply it, the blue goes to the skin, and then it Velcros on, and then with this short tail, you'll go through the buckle. So you go through the bottom part of the buckle or the smooth part of the buckle, and then come back through the teeth. And that just allows an added level of security. Okay? You want it tight but not too tight, which typically means 2 finger breaths underneath, 1 to 2 finger breaths.
What can I say?
When you tie your single release knot, it just means it's kind of like tying a tourniquet, where if you pull on one end of it, it just releases, but if you pull on the other end, it tightens it up. Okay? Realize I'm going to look at the process of it, but I do know that these chairs, it's very hard to tie them on these chairs because they're wide and slippery. So I just want to see like the process of it. And then it's going to help me with this. That side, I'll get this side. And you can either do it with them together or separate. If you do it separate, it's called triangulation. It's just a little bit of added security.
Nope.
Let's just have one. We can do one by
Go
one.
ahead and try your neighbors, because you're not gonna be able to do that.
I just need to pull it tighter. Pull on this string and this string together. That works. Oh, wrap it twice. It'll still be a single release, but not for the patient. Just remember we did this. I think this was and pull it tight. There you go.
Have you gotten to like check it out? Yeah, a little bit. Like with my everything was super horrible. I went to the
Works. Just wear this until we get somebody to look at your knot.
No, I don't know. She just I was supposed to take my schedule today, but she's sick, so probably tomorrow. I know. Are we scheduled for 2 days? Is that exciting? I have 2 days.